Hello. I'm Dr. David Thompson. Before we begin, I want to share a story that might sound uncomfortably familiar to many of you. 6 months ago, a lovely woman named Margaret, aged 68 from Ohio, walked into my clinic. Well, walked is generous. She was shuffling, heavily reliant on a metal walker, her face gray with pain. Margaret had been an active woman. She loved gardening and chasing her 5 grandchildren. But now, her orthopedic surgeon was telling her that her knee cartilage was virtually gone. It was bone on bone. The only option presented to her was a double knee replacement, followed by months of grueling rehabilitation and a future dependent on strong painkillers. She was terrified. Terrified of the surgery, terrified of the drugs, but mostly terrified of losing her independence and ending up in a nursing home because she couldn't care for herself. She sat in my chair and wept. She said, "Dr. Thompson, I feel my life shrinking." Today, I'm happy to tell you that Margaret did not have that surgery. Last week, she sent me a photo of herself kneeling in her garden, planting tulips. No walker, no cane, and crucially, no daily painkillers. How did this happen? It wasn't a miracle drug. It wasn't a stem cell injection. It was something that 97% of conventional doctors completely overlook in their rush to prescribe medication. We identified that Margaret was unknowingly poisoning her own joints every single day with foods she thought were harmless. Today, I am going to share the exact protocol we used for Margaret. I'm going to reveal the 5 toxic foods that are actively destroying your knee cartilage right now, and how removing them can be the key to saving your mobility. But first, I need to know who I'm talking to today. This is vital because knee issues manifest differently depending on your stage of life. Are you over 50 and feeling that morning stiffness? Are you an office worker sitting for 8 hours a day, feeling your knees lock up when you stand? Or perhaps you're a postpartum mom, shocked by sudden joint aches you never had before. Please, pause the video for a moment. Go down to the comment section right now and type in your age and the number 1 symptom bothering your knees. Is it pain going downstairs? Is it a crunching sound? Do that now. I ask this because I want to dispel a dangerous myth right now. The pain you are feeling is not just getting older. It is not just bad genetics. In my experience, it is almost always a result of chronic nutritional deficiencies combined with a toxic overload that your body can no longer handle. Your body can heal, but you have to stop feeding it the things that hurt it. For those who don't know me, I'm Dr. David Thompson. For over 30 years, I have worked on the front lines of patient care. I've seen thousands of patients, just like you, who were told their bodies were failing. My mission on this channel is to cut through the medical noise. I want to give you the science-based tools to live healthily and independently, without relying on a cabinet full of pharmaceuticals for the rest of your life. I've seen the human body do amazing things when given the right environment. Before we get to the foods, we need to establish a baseline. How much danger are your knees in right now? Cartilage doesn't have nerve endings. By the time you feel severe pain, the damage is already extensive. So, I want you to take this quick, 5-point self-test. Count how many of these apply to you. 1. Morning stiffness. When you wake up, are your knees stiff for more than 30 minutes before they loosen up? 2. Crepitus. Do you hear a crunching, grinding, or popping sound when you bend your knees? 3. Stair struggle. Is going downstairs significantly more painful than going up them? 4. Inactivity swelling. Do your knees feel puffy or swollen after sitting for a long time, like after a long car ride or a movie? 5. Night ache. Do you experience a deep, throbbing ache in your knees at night that sometimes disrupts your sleep? Count your yes answers. If you checked even 2 of these boxes, Your cartilage is crying for help. Why are these happening? The root cause linking all these symptoms is something we call chronic, low-grade systemic inflammation. Imagine your knee joint is like a precise, well-oiled machine. The cartilage is the smooth, Teflon coating on the gears that lets them glide silently. Chronic inflammation is like pouring fine sand and acid into those gears. It's a slow-burning fire inside the joint that grinds away that smooth coating faster than your body can repair it. The 5 foods we are about to discuss are the fuel for that fire. The first major offender is what I call the sweet assassin. It's not just the sugar bowl on your table. It's the hidden high fructose corn syrup and added sugars buried in 80% of processed foods. I had a patient named Robert, a 55-year-old accountant. He wasn't severely overweight, but he loved his sweet iced teas and healthy granola bars. His knees were constantly inflamed. He thought it was just his chair. We cut his added sugar intake to below 20 grams a day. Within 3 weeks, he told me the throbbing heat in his knees had reduced by half. He could walk his dog again without wincing. Why does sugar hate your cartilage? It comes down to a process called glycation. When you have excess sugar floating in your bloodstream, these sugar molecules act like sticky glue. They attach themselves to proteins and fats in your body, forming harmful new compounds called advanced glycation end products, appropriately abbreviated as AGEs. Your cartilage is made largely of collagen, a protein. Think of healthy cartilage like a firm, wet sponge that absorbs shock. When these AGEs form, they cross-link with the collagen fibers. It's like pouring caramel syrup into that sponge and letting it harden. The cartilage becomes brittle, stiff, and yellowed. Instead of absorbing shock, it cracks under pressure. Furthermore, these AGEs bind to specific receptors on your cartilage cells, called RAGE receptors, triggering them to release inflammatory cytokines that actively digest the cartilage matrix. This isn't just theory. A study published in the American Journal of Clinical Nutrition analyzed data from thousands of participants and found a direct, undeniable link. Individuals who consumed the highest amounts of sugary beverages had a significantly increased risk of developing symptomatic osteoarthritis compared to those with low intake. The science is clear. Sugar accelerates joint degradation. You must become a label detective. The goal is to keep added sugars under 25 grams, about 6 teaspoons, per day total. The swap: ditch the sodas, the sweet teas, and the store-bought fruit juices, which are essentially sugar water. Switch to water with a squeeze of fresh lemon, herbal teas, or black coffee. Beware of low-fat items like yogurt, which often replace fat with massive amounts of sugar to add flavor. How many of you check the added sugar line on nutrition labels? Let me know in the comments if you're shocked by how much sugar is hidden in savory foods like pasta sauce or bread. Our second toxic food group is perhaps the most insidious because for decades we were told these were heart-healthy. I'm talking about industrial seed oils, soybean oil, corn oil, canola oil, sunflower oil, and cottonseed oil. I remember treating Sarah, a 42-year-old postpartum mom. Her joints ached terribly after her second baby. She was eating lots of salads to lose weight, using standard store-bought dressings. Those dressings were 90% soybean oil. When we swapped her to genuine olive oil and avocado oil exclusively, her joint pain subsided significantly in just 1 month. The problem here is the balance of essential fatty acids. Your body needs both omega-6 and omega-3 fatty acids. Omega-6 are generally pro-inflammatory. They help your body react to injury, while omega-3s are anti-inflammatory, helping to resolve that reaction. Historically, humans ate a ratio of about 1:1 or perhaps up to 4:1 of omega-6 to omega-3. Today, Due to these cheap industrial oils present in almost every processed food and restaurant meal, the average Western diet is closer to 20:1 or even 50:1 in favor of inflammatory omega-6 excess. When you consume excess linoleic acid, the primary omega-6 in these oils, your body converts it into arachidonic acid. This arachidonic acid is the raw material used by enzymes, like COX-2, to produce highly inflammatory molecules called prostaglandins and leukotrienes directly inside your joint capsule. Think of inflammation like a campfire. Omega-6 are the gasoline. Omega-3s are the water. If you are constantly pouring gasoline on the fire, your joints will burn. You cannot out-supplement a high omega-6 diet with fish oil pills. You must reduce the incoming gasoline. Research published in the journal Osteoarthritis and Cartilage found that higher levels of omega-6 fatty acids in synovial fluid, the fluid inside your knee joint, were associated with greater knee pain and structural damage in osteoarthritis patients. The oil you eat quite literally ends up lubricating or irritating your joints. This is tough because these oils are everywhere, especially in restaurants. The purge. Go through your pantry. Throw away the bottles of vegetable oil, corn oil, and canola oil. The swap. Replace them with extra virgin olive oil for low heat or raw use, avocado oil for high heat cooking, or coconut oil. The golden rule. When dining out, assume everything fried is cooked in these inflammatory oils. Ask for meats grilled or baked, and ask for olive oil and vinegar on the side for your salads instead of the house dressing. This is often the hardest change for my patients. Are you willing to check your pantry right now and see what oil you are cooking with? Comment "Done" below if you're brave enough to make the switch today. Number 3 is the staple of the modern diet: refined white flour. White bread, pasta, bagels, pastries, pretzels. Let's talk about Michael, a 60-year-old retired teacher. He loved his morning bagel and his evening pasta. His knees were so swollen by the end of the day he had to ice them. I challenged him to a 2-week wheat-free trial. He was resistant, but he did it. On day 10, he called my office. The swelling had reduced so much he could see his kneecaps clearly for the first time in years. Refined white flour is essentially sugar in disguise. It has been stripped of its fiber and nutrients. When you eat a bagel, it is rapidly digested, sending a massive spike of glucose into your bloodstream. This spike triggers your pancreas to flood your body with insulin to manage that sugar. Chronically high insulin levels are disastrous for cartilage. Insulin is a growth hormone, but in excess, it promotes inflammation. High insulin levels stimulate the liver to produce C-reactive protein, CRP, a master marker of systemic inflammation that attacks joint tissues. Furthermore, many people have unrecognized sensitivities to gluten and other proteins in modern wheat, which causes leaky gut. This allows undigested food particles and bacterial toxins, LPS, to enter the bloodstream. Your immune system sees these foreign invaders and launches an attack, resulting in systemic inflammation that settles in the joints. Metaphorically, eating refined flour is like taking your joints on a daily roller coaster ride of sugar spikes and crashes, leaving them battered and inflamed. Studies consistently show links between high glycemic diets, foods that spike blood sugar quickly, and inflammatory diseases. A study in the Journal of Nutrition demonstrated that women with high glycemic load diets had significantly higher levels of inflammatory markers like CRP compared to those on lower glycemic diets. Elevated CRP is strongly linked to knee osteoarthritis progression. You don't have to give up carbs, but you must change the type. The swap: replace white bread and pasta with genuinely complex carbohydrates. Think quinoa, sweet potatoes, steel-cut oats, and legumes like lentils. If you must have bread, look for dense, 100% sprouted whole grain bread, sourdough, or rye, where the grain is still visible. The dosage: try to limit these starchy carbohydrates to 1 meal a day, preferably after you've been physically active, when your muscles can soak up the glucose more effectively. What is your go-to comfort carb? Pasta. Bread. Let me know below. It's hard to give these up, I know. Number 4 on our list of cartilage destroyers: processed meats. Bacon, sausages, hot dogs, salami, deli slices. I had a patient, Tony, a 58-year-old construction worker. He lived on deli meat sandwiches for lunch and pepperoni pizza for dinner. His knees were failing him on the job site. We swapped his lunch for leftovers of roast chicken or beef and cut out the pepperoni. It wasn't an overnight fix, but over 3 months, his morning stiffness time went from 45 minutes down to 10 minutes. Processed meats are a triple threat to your joints. First, they are loaded with preservatives like nitrates and nitrites, which can increase oxidative stress in the body. Second, they are incredibly high in sodium. Excess salt throws off your body's fluid balance, leading to edema, swelling, in the joint capsule, increasing pressure and pain. Third, and most importantly, these meats are often cooked at extremely high temperatures, frying bacon, grilling sausages. This high-heat cooking creates, you guessed it, a massive amount of dietary ages, advanced glycation end products, those same sticky compounds we discussed with sugar. Eating heavily processed meats is like subjecting your cartilage cells to chemical warfare every single day. The World Health Organization has already classified processed meats as carcinogenic, but their role in arthritis is just as concerning. A large cohort study published in Arthritis Care and Research followed thousands of people and found that high intake of red and processed meat was associated with a higher risk of needing a total knee replacement due to severe osteoarthritis. We need to get back to real food. The swap: instead of deli turkey loaded with sodium and nitrates, roast a real turkey breast on Sunday and slice it for the week's lunches. Instead of bacon every morning, try smoked salmon or eggs. The golden rule: if the meat has a shelf life longer than fresh meat should, or if the ingredients list reads like a chemistry experiment, don't eat it. Treat bacon and sausage as a rare treat, not a daily staple. Be honest, how many times a week do you eat a sandwich with deli meat? It's a convenient habit, but it's costing your knees. Our final toxic offender is perhaps the most useless item in the human diet: dark colas and sugary sodas. Let's go back to Margaret, the patient from the beginning of this video. Margaret wasn't a big drinker of alcohol, but she loved her diet cola. She drank 3 to 4 cans a day, thinking it was fine because it had 0 calories. It was one of the hardest things for her to give up, but also the most impactful. We already talked about the sugar in regular soda. But diet soda is no better, and dark colas have a unique weapon against your joints: phosphoric acid. Phosphoric acid is added to colas to give them that sharp, tangy bite and to act as a preservative. The problem is that your body maintains a very delicate balance between phosphorus and calcium in your blood. When you flood your system with massive amounts of phosphoric acid, your body screams, "Too much phosphorus." To restore balance, your body must neutralize the acid. How does it do that? It pulls alkalizing minerals, primarily calcium and magnesium, out of your storage banks. Where are those storage banks? Your bones and the subchondral bone that supports your cartilage. By drinking these colas, you are essentially leaching the structural integrity right out from under your cartilage. It's like acid rain slowly dissolving a beautiful stone statue. This is well documented. The famous Framingham osteoporosis study, published in the American Journal of Clinical Nutrition, found that women who consumed cola daily had significantly lower bone mineral density in their hips than those who didn't, regardless of their calcium intake. Weaker bones mean less support for cartilage, leading to faster degradation. There is no safe dose of soda for someone with joint concerns. The swap: if you crave the fizz, switch to sparkling water. You can add fresh lime, lemon, or even a splash of 100% tart cherry juice, which is actually good for joints. If you need caffeine, stick to black coffee or green tea, which contains anti-inflammatory polyphenol. Are you hooked on the fizz? Have you tried quitting soda before and failed? It's addictive. Share your struggles in the comments. You are not alone in this. Let's summarize. To save your knees, you must declare war on 1. Added sugars and high fructose corn syrup. 2. Industrial seed oils, soybean, canola. 3. Refined white flour. 4. Processed meats containing nitrates. 5. Dark colas and sodas containing phosphoric acid. I know this sounds daunting. You might feel like I've just taken away all your favorite foods. But I want you to shift your perspective. Think about Margaret. She traded the temporary pleasure of a soda and a bologna sandwich for the ability to kneel in her garden and hold her grandchildren without pain. Was that trade worth it? She would tell you, with tears of gratitude in her eyes, that it was the best trade she ever made. Your joints are engineered to last you a lifetime. They are durable, resilient structures if you stop poisoning them. Don't accept chronic pain and declining mobility as a normal part of aging. It is common, yes, but it is not normal. Please, take this information seriously. Try eliminating these 5 foods for just 30 days. Treat it as an experiment. Your knees will tell you the truth. If you found this video helpful, please subscribe to the channel and hit the notification bell. In the next video, I'm going to share the opposite side of this coin, the top 5 builder foods that actually provide the raw materials to repair and regenerate cartilage. You won't want to miss that. Whatever your age, it is never too late to start healing. I'm Dr. David Thompson, and I'm rooting for you.